Hello, everybody, and good evening to Dr. Stacy's Q&A Longevity and Wellness webinar. I am so excited to be here again tonight and host this for her. Stacy is traveling, and I'm always excited to be a part of this. But I'm very excited for you to meet our guest this evening. These three ladies are extremely accomplished, very well known, and are incredible in their fields. And so I don't want to waste anybody's time because it's precious. But those of you who are new on here tonight, give me a moment. Let me introduce myself. My name is Laura Balzer. I'm a Senior Presidential Director with Lifewave. I have been a part of Lifewave for over 3 years. And when I say that out loud, it just boggles the mind. I don't know where the time has gone. It is really the best decision I have ever made in my life, in my business life. And so I have much gratitude for that. So with that said, I do want to take also a little time to read our disclaimer or talk to you a little bit about the information that you're going to hear this evening is for educational purposes only. We are not here to cure, diagnose, or treat anything that you may have in existence at this time. Even though we have an amazing panel of doctors with us this evening, they are not your doctor. And so we want to make sure that you are always letting your doctors and your practitioners knowing what you're embarking on. You never know what you might educate them on. And as always, if you're pregnant or nursing, we definitely want you to take the time to be in touch with your practitioner and let them know what you are doing. So with that said, I'm very excited to welcome our first guest, Dr. MJ. Would you please say something so we can pop you up on this screen?
Thank you so much, Laura, for having me. I really appreciate it.
Well, you're very welcome. I want to very quickly make sure that, it's not letting me pin you to the top, and I would like to pin you, but it's not letting me. So we're just going to move on.
We just got to move on.
We're just going to move on. So Dr. MJ, I'm very excited to have you this evening. You're incredible in your field. So I'm just going to turn it over to you, introduce yourself, let them know your practice, and then what life looked like prior to being introduced to this wearable light technology that everyone's going to hear about, and where you've taken it to today.
Thank you so much, Laura. I really appreciate it. Hi, everyone. I'm Dr. Mary Jane Hanlon. I am from the New England area. I spent most of my time in Lexington, Massachusetts, but now live in Wolfboro, New Hampshire, where I do practice part-time as a general dentist. So I am kind of semi-retired. So I say that jokingly because I still work 3 days a week, but I don't own a practice. I don't want to own a practice anymore. Been there, done that. Don't want to do it again. So I spent about 20 years in private practice in Lexington, Mass, and then was recruited to go to Tufts University, where I was dean of clinics for 10 years. And so I got the academic bug, and I absolutely loved it. I love teaching. I love sharing my knowledge with my students, and then left there in 2021 to pursue an opportunity down in Knoxville, Tennessee, where I was supporting the dean of that school in starting a brand new school. And while I was down there, we decided that we were going to purchase practices for the students to go into to start getting experiences really early. One of the biggest challenges that I see in dental education is it really hasn't changed since the 1800s. So while there's a lot to learn, they still teach it the same old way, and there's so many other ways that we could be doing it better. So we started to buy practices down there, and that led me to being an owner of, 8 to 10 practices by the time we were finished. And that was challenging. And I ended up being in business with a very narcissistic business partner, which I did not realize at the time. And unfortunately, got very sick. I ended up having to leave that business and come home. But before I did, I realized that my blood pressure was extremely high, dangerously high. And for those of you who understand blood pressure, Mine was 230 over 132. So I was a stroke waiting to happen. And luckily, my husband was introduced to Lifewave probably 2 weeks earlier by our good friend, Nancy Cook. And as soon as I got to his house in Florida, he started patching me up. And in about 2 weeks, I had gotten it a little bit under control, but it took probably about 2 months and it blew me away. I went to a follow-up appointment and my blood pressure was back to normal. So I know that stress causes a lot of things to happen in people's bodies. Obviously, that was my way of coping with the stress of, an unfortunate business situation. But my blood pressure was really high. And I am extremely thankful that I was introduced to the patches because there was nothing else. They couldn't get me under control, even in the hospital with medication. So there's something more going on in my body than just the typical blood pressure issue. And I was very happy that I was introduced to the patches and that I recovered from that. Now, I believe totally that our bodies can heal themselves. I was told at 30 years old that I had a hypothyroid problem. I'm not a very good medicine taker. I never will be. So even to this day, I don't take the blood pressure medication that they've told me I have to take in order to live the rest of my life. I don't do it. That's my personal choice. I don't recommend that for anybody. But personally, I have found that my blood pressure stays under control as long as I mediate my stress and I keep the patches on. So that was my first personal experience with the patches, and it was pretty significant. My second experience with the patches came probably back in July. And during that time, I had been away from home for 2 years and didn't really have a set exercise routine. And so I decided I had to get back into shape. And part of what I always did was eat healthy and exercise. And during that 2-year span of being down in Tennessee, I really just only walked and didn't have much of an exercise routine. So decided that I'd hire a coach and get back into shape again. And as many of you might know, the first time you do anything, just like flossing your teeth, your gums hurt when you floss for the first time. When you exercise and you're lifting weights, your muscles hurt. And so I was expecting this really horrible week coming up. And I just knew it was coming because, squats are really tough on the legs and, any kind of time, when you first start lifting weights again, the muscles are sore. I had zero pain, zero. So I know it came from the X39, X49 that I was wearing in the Eon that I was wearing every single day. So 2 really significant experiences. Now I've been on the patches for 6 months now, and I'm in my 60s. So I'm starting to see some outward signs of improvement in my facial lines. So I'm really excited about that. So I can't say enough about the patches from my experience. Now, from a professional standpoint, if you've done any research on these patches, one of the things that they do is they create bone or help with bone regeneration. And with me, I'm very concerned about periodontal disease and the impact that these patches might have on people who do have periodontal disease. So I started tracking some patients that are patching and who do have periodontal disease, and I'm starting to see improvement. So I'm extremely excited about that for the dental profession, number one, because it will help us to eliminate dentistry is the only profession that wants to get rid of itself. We have fluoride for cavities. We're trying to get rid of cavities so that people and our generation, our children's generation, well, my child's generation, we have kids that didn't have cavities at all because we use sealants. So, I think that we are really prone to wanting to eliminate and prevent disease as much as possible. So this being a potential support to a good oral healthcare routine is extremely exciting to me. So for anybody out there that does have periodontal disease, please have them, and you decide to patch, please have them track your charting. And what I mean by that is they'll chart your pocketing levels, which anything from 0 to 3 is healthy. Anything 4 to 6 is the beginning of periodontal disease. And then anything over 6 is pretty substantial periodontal disease, and you might lose teeth. So if you have periodontal disease, it'd be worthwhile to try to patch and see what happens. So that's my experiences, Laura.
Wow.
And, you know, I can't say enough about it.
I love that, and Dr. MJ. So let me ask you a couple questions.
Sure.
I love that you're talking about the bone growth, bone density, right?
Mm-hmm.
And you can only imagine what's going on in the rest of the body if it's working in your arena of care.
Sure.
You know, and I love that, because do you find with patients that if they are experiencing this on a dental level, and I'm asking for education, do you find throughout the rest of their body that that might be a concern as well? As
So
far
you mean
as
if they,
osteoporosis or things of that nature?
so I think the big key here is that the one thing that really people need to understand is any kind of bacteria in the mouth can get into the blood system and into our bodies and affect every organ that we have. And we're finding that more dis-ease in our bodies is caused by bacteria in our mouths. So if we're not keeping our gum tissue clean, if we're not brushing really well, and we're choosing not to do the things that we know that we should do every day, brush twice a day, floss once a day. I mean, it's pretty simple. It doesn't take that much time. That bacteria, if you're finding that your gums bleed during brushing, then that bacteria that's in your mouth is getting into your system. The number one reason that cardiovascular disease is so significant right now is because of periodontal disease. And the correlation has been studied significantly in the PubMed, the research in PubMed is just substantial.
Wow.
So,
that's amazing.
Yeah.
I'm so glad that you said that for everybody that's on here tonight, because, I don't think we look at things like that sometimes. We don't think about them, and not because we're not concerned, we just don't know too. And
Right.
so I'm really glad. One last question for you, because you've been absolutely amazing. Obviously, you've gotten your blood pressure under control. You're monitoring your stress level, which everybody should for all things. But we always find when people start using the patches that they start noticing other little things. Can you give us like maybe 1 to 3 little things that like be it energy, be it better sleep, are some other things that you've noticed in the process that you weren't expecting?
You know what? I'm glad you brought that up, because I didn't mention my sleep. I have had trouble sleeping. I used to joke with my mom, and if she was still alive, she'd chuckle now, but I would have killed me if I was her when she was younger. I used to joke with her, Mom, just have a shot of vodka or something. It'll make you go to sleep. And she would talk about being up all night. And I just feel so badly now, because I experienced that all the time. But when I wear my silent nights, I go right to sleep, and I have a very deep night's sleep. So yes, that's a significant improvement.
That's amazing. That's amazing. Dr. MJ, I have not heard your story, and I feel very thankful and grateful, because I did not know this. And I know everybody on here, I know you've touched somebody on here and helped them greatly. So thank you. And even though you've been only patching 6 months, we're going to have you come back and give us a little bit of an update. Absolutely, please.
Thank you. It would be my pleasure. Thank you, Laura, for having me.
Thank you so much. Dr. MJ, if you'll go ahead and mute yourself out, I'm going to welcome to the platform here Dr. Debbie Beavers. Debbie, can you speak and say something so you'll go in? There you are.
Can you hear me?
I can hear you.
Hello.
I can hear you. Dr. Debbie, you're an amazing practitioner, and I just want to give you the floor and let you introduce yourself as to your practice, what you do, how long you've been doing it, and then just like Dr. MJ, what was life for you? I know you've got many lives you're going to talk about, but what was life for you prior to introduction to this technology, and where are you with it now and in a whole?
Okay, thank you for that. And thank you for the introduction. So I've been all about alternative natural medicine for over 40 years now. So, and I didn't get into this because I was in perfect health. Most of us get into this profession because we're working on a health issue, which was my case. So, and I had 2 babies in diapers and one that was just starting kindergarten. So I went from, get ready for this.
Okay, I'm gonna write it down.
From being a DJ and teaching dancing lessons to a doctor. I'm just saying, yeah. So, but I was diagnosed with a bunch of different health issues and was told I wouldn't be here in about 3 months' time if I didn't do treatment X, Y, and Z, which I chose not to do. So fast forward to 8.5 months later, when I was completely disease-free, I started taking the lady that helped me, I started taking her advice and started seeking out all the different courses that were available to me to where I didn't have to leave my children at home and would be able to do the studies. So 19 different degrees, licenses, and certifications later, I'm not going to do any of those schools anymore because I absolutely love to help heal people. So I have like a 5 to Thrive that I practice here in my office because I specialize in all things biofeedback. So we do everything from 3D scans to X-rays to hormone therapy, you name it, we do it all. And now that I have the patching as part of the 5 to Thrive, that's actually number 1. They actually can have a written guarantee if they request it, because everything I do is customized for the individual. It's very simple. They're not put on a bunch of different things because of what we're doing with their cells. Because the number 1 thing I explain to them is I cannot get you well until we fix your cells. So it doesn't matter the name of the disorder or the imbalance that they come in saying they have such and such, and have I ever worked with this type of disorder? I have all of the equipment here that will find what's out of balance, and then it lines out a program totally customizable to that individual based off of their DNA, their frequency. And as you know, energy is frequency, all of that's information. So we are able to really take them to the next level of health. In other words, I tell them, I don't want you to stay just feeling good. We're going to bypass good. We're going for great. So my favorite thing to have people on is the X39. And I don't bombard them with a bunch of information in the beginning. They walk out of here, number 1, with their new client folder. And then when they come back in 2 to 4 weeks, we go over all of the information that's also handed out in this folder with the Lifewave info. And within usually 2 to 4 days, they are already sending me text, or they're calling, or they're sending emails saying, I want to know more about these little cute band-aids that you had all over your body from your ankles to the back of your neck. I wear these up here by my thyroid. I do all the things. And so then I call on Miss Leah to help me out.
I love that. Okay.
I'm just saying, I'm like, Leah,
I love that. I love that. Okay, so let's back up just a little bit. So
Sure.
Let's talk about you for a minute. You are head to toe, you just said it, in patches.
Yes.
What was going on for you personally before you were introduced to this? Let's talk about you, because I think that's just a great place to start here.
It is a great place to start because it's actually unbelievable, because Sharon, one of my best friends who introduced me to Lifewave, happened to be at my office one day when I wasn't feeling good, talking about what the other doctor said about blood pressure and stress. When you're dealing with life and death situations in your office every single day for over 40 years, that can definitely bring on stressful situations. So blood pressure was sky high. I wasn't feeling good. The heart was racing. In my 20s, I had been diagnosed with mitral valve prolapse and AFib, which are two things that I personally was diagnosed with. So those were some conditions that I was dealing with and trying to get myself back into balance, but I was on a ton of different medications, again, that I had been on since in my 20s. And Sharon said to me, Debbie, just why don't you try these patches? It's just something that I think will work well for you because you're all about the health of the cells, and this is going to help your cells. I'm like, okay, you know what? I learned all about that in college. I don't see how this sticky little thing can help me do anything, but I felt so horrible that particular day that she was there in my office, and she was watching me, putting the blood pressure cuff on, checking everything, doing deep breathing, the whole 9 yards. And she said, I'm going to go home. I'll be right back. She brought them back. Okay, you ready for this? 4 days later, I'm in session with a client, and I felt this strange feeling because remember, I was still on all of my medications. Okay. So I excused myself, told them I would be right back. I was going to go get a drink. Well, I went and checked blood pressure. It had dropped very low and the pulse was very slow. So I called the cardiologist. They sent a message to him. Anyway, he's telling me, go eat some Fritos, eat something salty. I said, I don't have Fritos. I don't have any junk food in the house. He's like, you got a neighbor? Go get something to get your blood pressure. It was low. It was like 89 over probably 50 something. I can't remember. It was low. And so I thought, surely it's not these patches. So I called him back that afternoon because, again, I didn't have anything salty, nothing to bring the blood pressure up. And so he says, why don't you come on in? So fast forward, he ordered all this blood work, ordered all these things. When the reports came back in, he said to me, I don't know what these sticky things are all over your body, and I need you to explain to me what you're doing because something has transpired here. I said, I've only been wearing these. It was either 4 or 6 days. I said, I've only been wearing these 4 or 6 days. I don't understand enough to even be able to tell you about it, other than it has to do with blah, blah, blah that I'm not supposed to say. And he was like, okay, I need you to go have your blood test redone again because your numbers have all dropped. Everything is improved. I don't see this disorder. I don't see that disorder. Everything has changed. So I went from being on 8 medications. This all happened in less than 2 weeks, y'all. All these medications through trial and error down to one as needed. And it's the lowest dose. And when you see me checking my blood pressure now, I'm making sure it's not too low. I'm just saying, miracles happen. I was so elated. I was like, okay, I'm bringing this into my practice. I called Sharon back. I said, I want one of everything they have. And let me show you my cute little box that I put it in. It's all alphabetized. I love this because I'm OCD, y'all. I have to be organized. I have to be able to see that I've got plenty of everything that I need. And she said, well, girl, I think it's kind of expensive. I said, I got credit cards. I want one of everything. And everything took off from there. And
Wow.
Yeah,
Wow.
that was huge for me. I'm telling you, huge, because to be on that kind of medication from your 20s, and I just rolled into having my 65th Medicare, Medicaid, whatever birthday, and that's a whole experience in itself. If that doesn't motivate people to do something to keep their self well, I don't know what will, because that was a scary feeling.
Right.
And you don't get any kind of discount on your rates of anything for investing in natural things for your health. Just thought I'd throw that out there.
No, Dr. Debbie, I love, that I'm a big advocate of regenerative medicine and natural ways of taking care of the body. The body is very powerful.
Yes.
You give it the tools that it needs. And so I've never heard this, just like I have never heard Dr. MJ, and that is absolutely phenomenal. And everybody in the chat is kind of going crazy right now because of this.
Girl, I'm telling you, Sharon was even like going, "Oh my gosh, you've got to tell everybody." I'm like, "Well, but wait, let's make sure it lasts because."
And you've been using the patches now for how long?
It's been close to 2 years, maybe a little longer.
Okay.
I want to say I can't remember. It seems like just yesterday. But I tell you what, the 39 I know does everything. You know, it just, you know, for people who are on a budget and that's all they can afford, that is definitely where they need to start. But it's the X39 that even on the literature talks about lowering the numbers that I was telling you about.
Sure. It's okay. You can, that's okay.
Can I say it? Blood pressure.
You lowered you're just
the pulse. I'm just saying.
Yeah.
And so that was the miracle one because those were the only ones I had with the Eon. And then when I learned about Alavida, took me to a whole different, y'all, this lengthens your telomeres. This can extend your life by 20 years just like that. Telomeres, if for those of y'all that don't know, are like the little shoestrings in your tennis shoes. So if they're all frayed and they, you know, or you got a puppy like I do that chews them all up, then your life is going to be all chewed up in bits and pieces, and you're going to have a whole bunch of health issues. But if they're tight and they're firm, like a brand new shoestring would be, that is going to guarantee you a tight, brand new, longer life here on Earth. This has to be done at night. It just has to. That's in everybody's program. I know everybody talks about how great this one is, the dynamic duo with this one and that. I'm like, oh no, this has got to go in because I guarantee my work. So hello, I need their life to be lengthened. I'm just saying.
No. And Dr. Debbie, I appreciate you showing that because I know it's, people are like, well, wait, you know, my husband and I go to bed every night and our Alavida is right here in the middle of our forehead. It's very sexy, right? But you know, I don't care. We're living longer together. So,
yes.
All right. So we have a lot of excitement going here. So let's hone in just a sec because we want to give Dr. Holly a chance as well. But okay. You've obviously had tremendous result. I know you'll never stop patching. I'm not even going to ask you the question. Give us a very small snapshot because I think you've offered so much value already. Answer this. Are you seeing the same type of result with the different things that your clients are seeing? Are you seeing the same things through them and with them?
Yes. Absolutely, because I specialize in helping people over the age of 50 with cardiovascular issues.
Okay.
Blood sugar issues, though, are actually the easiest. I mean, the results are just through the roof, tremendous. There's never been a case that has failed because we customize their food program. So obviously we're taking them off of sugar, which is the main destroyer of all health issues, period, dot, end of story. And by changing their eating program and putting them on the patches and just maybe 1 or 2 supplements, that's it. Within 1 or 2 weeks, people that have been on tons of medication are having to drop the medications down, and that's their doctor doing it, not me, not them. The medical doctors are doing that. Right. Because anybody that's going to be a client of mine, if we're working with cardiovascular or blood sugar, I make them send me the picture where they order their little units from Amazon because I want the readings, because I warn them, listen, it's going to change this fast.
Wow. And
for those, I use the X39 and the carnosine and the Eon with Alavida at night.
Beautiful. Well, woo. Well, we thank you. And just like speaking to MJ and I know Dr. Holly, we're going to say the same thing, but I know that everybody would enjoy for you to come back and share as you see these results in your clients and what are you seeing and what are they using? Because I think everyone is looking for a different avenue because they've been dealing with things for a very, very long time and they're still waiting. And I feel like you've given them a lot of hope with what, you know, you've experienced. So thank you so much
Absolutely.
for being a part of this with us. And if you don't mind, I'm going to ask you to unmute so we can bring Dr. Holly in.
Hey, Laura.
Hi, thank you for saying that. It just pops you right up on the screen. So, you know, you need to be congratulated, Dr. Holly. This is just very new and we're very excited to hear from you. And so please, just like the other ladies, let us know your practice. Let us know, you know, a little bit about you. And then just like them, what was life like prior? And what are you seeing with yourself and the people you work with?
Thank you for this opportunity, Laura.
You're welcome.
I started out in healthcare 40 years ago, back when I was 16, starting as a nurse's aide. Then I went on to become a nurse. So I was on that side of health, the Western side. And I did that for several years until I had a health crisis when I was 26 years old. And my memory, actually, at that age, I was having problems with. I would go to take a blood pressure, and by the time the mercury fell in the sphygmomanometer, I couldn't tell you the numbers.
Wow.
I went to the doctor, and the doctor's just like, "Oh, you're a new mother." And I'm like, "Oh, no, no, no. This is not normal. I don't care what you say." I had to write every single thing down that I needed to do when I was at work before I would go into a room to assist somebody. And I was like, this is just so not normal. So my journey into alternative health really began at that time. And I had found a naturopath, and she helped heal me through herbs. And herbs have been a very primary resource for me and something that I've used over the past 30 years. And over time, I've also become a craniosacral therapist. And then about 15 years ago, I went to acupuncture school. And I will tell you that the patches, I was introduced by Stacy, who I had met at a cranial intensive probably about 15 years prior. And when I saw her and she spoke about using them with her daughter, I was like, knowing Stacy, I'm like, that's it, I'm in. If you're using them, and because I knew how integrous she was with her daughter and helping her with everything in life, that I was like, okay, I'm definitely in. And I started the patches. We were at the Consciousness Conference for Consciousness and Human Evolution in Florida. And within 2 hours, I felt a difference in my body. I had put the patch on the back of my neck, X39. And I was like blown away by the fact, because I'm very sensitive, so I can feel things in my body. And I said, all right, I'm in. I'm going to do this. And the first patches that I started with was X39 and Energy Enhancer. And I do a lot of education. I have for the past 15 years in acupuncture and Chinese medicine, which is actually a very extensive study. And when I was doing classes, I would go on a Zoom, and about 20 minutes in, I'd be like, oh my gosh, how much longer? Because my mind would start to wander. A little squirrel, you know. So it was difficult for me to be able to focus. So I would have to stop the Zoom. I would a lot of times not do it on the live stream. I would go back and I would have to listen to it again and listen to it again, stop and go over things to be able to really integrate. So this is the amazing thing. After I put those patches on, I could go 6 hours on a Zoom. That's tremendous. To go from 20 minutes and starting to just lose it, to be able to go 6 hours focused, it was just tremendously huge. As a matter of fact, it was so huge that I went back to school and got my doctorate in acupuncture and herbal medicine. I wouldn't have been able to do that if I wasn't doing these patches. It's really helped my brain function.
Let me interrupt. Let me be rude just a minute and interrupt. A lot of people might be thinking that, oh my gosh, she was able to not, 20 minutes to 6 hours. Explain to everybody that the way you feel is not that from like a cup of coffee or a Red Bull or something like that. It's not, that's not what we're talking about here. Can you explain that a little bit, Dr. Holly?
Yeah, so it's definitely, it has nothing to do with feeling jazzed up from taking a stimulant. There's no stimulation in that manner. It's being able to have your body function the way that it should, so that you're able to think and be able to put, I was able to do much more complex thoughts together, to be able to really put together complex concepts, because Chinese medicine is not cookie cutter. Everything is quite unique. Every person is looked at as an individual, just as the other doctors have been talking about too. Everybody's looked at an individual, but you have to look at things through many multiple lenses. So to be able to synthesize all that information together, it can be challenging. So to be able to sit and listen to these complex concepts, and to be able to put and synthesize things together and understand it on a very deep level, it just took my ability to understand much, much deeper. I had had multiple injuries in the past, car accidents, skiing accident. I hit my head so hard I couldn't see color. So that was one of the hits. So sometimes when I would be talking, I used to just stop. And it's not that the thoughts weren't in my head, but they couldn't come out. So now I have much more free flow of thought. And to be able to go to school and get your doctorate, that's a lot of cognitive thinking, a lot of paper writing, a lot of being able to get your ideas across, and being able to synthesize together complex cases. So to me, that's huge.
Wow.
For me, it was really the brain function is what I noticed. Plus I have hair. I'm so happy I have hair, because I had female pattern baldness. So I have no, and people are always like, oh, well, show me some pictures. I'm like, I didn't have pictures. I didn't take pictures because I was bald. So
Wow.
another thing to be able to have my hair, have my ability to think straight. I feel fantastic. The energy level, and it's not a coffee energy level. It's just a sustained, being able to go all day. I can start work at 9 o'clock in the morning, be done at 7, and then go take a walk in the woods, and I'm good. So I was not like that before the patches. I would peter out pretty quickly. So I was able to increase my workload by probably about 25%.
Wow.
So.
Okay, wow. I mean, Holly, we've known each other just for a couple of years. And I think all of us notice differences in each other, visual differences, that because we're on Zooms together all the time. And I mean, your hair, amazing, your skin, amazing, but then you go into all the other things that I think affect people, cognitive issues. That's a big one these days. Be it 30, 26, or be it 60, 70, or 80. It's becoming more and more of an issue. And I love that you went into it. So your clients, tell me about your clients with this.
Well, okay, so my experience of doing acupuncture, I can help clear people out and help people to be really healthy, usually just with acupuncture. And then if they're still having issues, I will add herbs on top. And that's how I practiced for years, with really, really good results. This has taken it to a whole nother level, because these patches can do things that nothing else can do. There's a nourishment to the body that the body's able to give itself by the activation from the patch that you cannot get from herbs. So that just takes it to a whole nother level.
Wow.
Makes sense to you?
It makes a lot of sense to me. I'm going to get into this a little bit, but even the clinical studies were done on acupuncture points. We're using the meridian of the body. And so, you know, that's got to be a big plus for you, especially with your clients. So Dr. Holly, share this with me. What is probably the top one or two things that you feel that this wearable light technology, this X39, that just really stands out to you, maybe personally and in your practice? Like what are those things?
Well, to be able to see people's organ systems function better, like people getting off of oxygen that have been told you're just going to keep going downhill, it's the slippery slope downhill, and see them be able to feel better, look better, have better circulation, be able to be back into life instead of being sitting on the sidelines because they don't have the energy to be able to do that. That's huge. Absolutely huge. The benefits are just so mind-boggling because you would think, oh, it's just this little patch. How could it do it? But it does. And that's the most amazing thing to me. For me, the energy level and the ability for me to be able to go and get my doctorate, to be able to have such clear cognition, it's changed my life. So
what do you see in the future for you with your practice and offering this? What do you see in the next five years?
Oh, I can only say that it's going to continue to grow. I will say that I have had people come in that have been on even maybe like a limited income, and I have said, I feel you will get more from this patch.
Wow.
Because you look at the whole situation, because to me, it's all about what's for the highest good of the client. It's not about me. So for me, it's like, okay, I think for you, with your situation, this is going to give you the most, and this is going to help you to improve your health over time. And then that's what I'll recommend.
Wow. Well, and I'm not going to ask you this question because I know the answer, as the other ladies, the other doctors on here this evening. I know you'll never stop patching. Well, Dr. Holly, we are all so grateful that you came on and shared with us. And just like the others, you know that we're going to want you to come back and continue to share the things that you're noticing, because I think it does nothing but help those, bring hope to those, and lets them know that there is an answer, and it's a very easy one. And I'm very grateful, and I know everybody else is. Thank you so much.
Thank you.
Thank you. Okay, so, oh my gosh, I want to share with everybody, thank you. We had a little, Houston, we have some problems with the technology. Zoom updated tonight, and it kind of threw us off a little bit. So we apologize for the bouncing screens there, but wow, I don't know if you guys are as blown away as I am. I have not heard either or any of the stories and testimonies that these doctors shared with us, and I'm totally blown away. But for those of you that were invited here tonight and you're thinking your head is spinning, I want to share with you what they're talking about. And it's, you know, it is a patch, and I am excited to share it with you. I'm going to peel the back of it here so you can see it through and through in its eternity. So you guys, this is what we're speaking of tonight. This little patch about the size of a quarter. And you can see that it's stuck to my thumb. So it's very sticky on one end, very smooth on the other. Now, what I personally love about this technology, this wearable light technology, is how easy it is to use. But this patch is a little bit different than maybe what you're used to either have used or heard about. You know, I think we're all accustomed to the patch era of a patch that you place on your skin, but I want you to realize that that patch is a transdermal patch. It's a patch that has some type of solution, an herb, a chemical, a substance on there that when you take that patch and you place it on your body, that solution of whatever that might be is going to go into the skin or through the skin, enter your body, and go to work doing hopefully what it's promised you to do. And you know the list of these things. Let's support your hormones, let's lose weight, let's quit smoking. The list goes on and on and on, right? But here's what's different about this patch. It's non-transdermal, meaning nothing's going in the skin. Nothing is entering your body. And you heard the doctors here tonight talking about their clients that were on multiple modalities, multiple pharmaceuticals. And we want you to know whatever you're doing, okay, there's no contraindication or no interaction. So you're perfectly fine and safe to use this with whatever you're doing. But like Dr. Debbie shared this evening, her goal is to get those clients of hers off those pharmaceuticals through the direction of their doctor, right? So how does it work then if there's nothing going in the body? Well, here is where all the magic lies, if you will. In the center of this patch is a proprietary blend that our owner, our CEO, and the inventor and scientist behind this technology has put together. And it's a proprietary blend of organic amino acids, water, sugar crystals, and oxygen. Now, they might sound like things you might find in the kitchen, but they are not. These are things that David Schmidt has in his lab, and it took him 10 years to develop that proprietary blend to activate the regenerative cells in your body. But again, how does it work? Well, our bodies are low-level infrared light, everybody, or heat. If you were to touch your chest right now, you could feel the warmth coming off your body. You can't see it unless you're wearing night vision goggles or infrared goggles, okay? But that light or that heat that we permeate, it comes off our bodies about 2 to 4 inches. You cannot see it. So we're like a power source. So when I take this patch, okay, with this crystal lattice structure of that proprietary blend, so it's a structure that comes together, it's a very tight weave. I like to say, think of a mirror. It becomes reflective. So when I take this patch and I place it on my skin, the light or the heat that I'm emitting bounces off the center of this patch. I'm gonna put my screen down so you can see it a little bit better. Bounces off the center of this patch and reflects back towards the body. But when that happens, it comes back in a very specific wavelength of light. So it's instructing our bodies, no different, analogy purposes only, no different than when you go outside during the day in the sun, that sunlight hits your skin, okay, and instructs your body to produce vitamin D. Now, you do not need to be in the sun to wear this, right? That was analogy purposes only. But this is the same concept here, except our bodies are the power source, okay, to produce and elevate a peptide called GHK copper peptide. Now, I encourage everybody on this call to, when you get off, I want you to go, you can go to PubMed, you can go to wherever your search engine takes you. And I want you to look up and read about GHKCU. You guys, the healing properties that this peptide offers our body is absolutely amazing. And the truth of the matter is we were born with this peptide. We really didn't discover and know about it till Lauren Picard 53 years ago through his research discovered this peptide. Now, here's the great thing about this. You saw every one of these ladies. The only one we didn't ask her age was Holly, but they all looked amazing at the age that they are. Did you see their skin? Did you see the brightness in their eyes? Right? The energy that they were exuding. So when you talk about the skin, that's one of the huge benefits of GHKCU. But there's other benefits as well. The support of cognitive or brain imbalances. You heard Dr. Holly speak about what happened to her. Cardiovascular issues, heart, vascular system, the supporting of organs, the increase of metabolism, right? All the ladies just went, give it to me. I need to increase my metabolism. But here's the beautiful thing about when we raise this peptide in our body, we're instantly, when we put this patch on, we are starting a process of resetting a third of the genes in your body to a healthier, younger expression. And genes are infamous for expressing to one another. So the body is activating and mobilizing in the manner in which it should. And when this process takes place, one of the genes instructs our bodies to raise and elevate, wake up and mobilize again your regenerative cells in your body. These are the cells that get to the root of problems, right? They rush in there, get to the root of the problem, and give the body the ability to restore and repair. We kind of lose that ability as time goes on. You know, I think a lot of us forget, I know I did when I was introduced to this, I didn't think about things like this. But you know, we started out as one of those regenerative cells. The egg and the sperm got together, had a little party, right? And this regenerative cell started to take place and come together. And this is where that embryo started the process of splitting into other individual cells that created the brain, the heart, the cardiovascular system, our limbs. So when we were born with an abundant number of these regenerative cells. By the time we're 30, 35, you guys, not so much. We have maybe half. Now, I don't know about you and maybe some of the things that you noticed when you were kind of 30, 35. My big one was recovery. But other people are noticing little aches and pains that they didn't have before. Maybe the sleep wasn't as good, or they felt like they couldn't control the stress levels as well as they did. And you know, when I talk about recovery, it could be a lot of different things. I did a Zoom earlier today with a group of people, and we were talking about how, you know, when we were younger, yeah, you guys know, we could go out, we could stay out to 4 o'clock in the morning, get up at 7, and we were back at the office. We didn't miss a beat. We go on vacation now, and everyone comes back from vacation going, I need a vacation for my vacation, right? But you heard from these ladies tonight, the energy that they feel at the ages that they are. But here's the thing, as that time continues to go on, by the time we're 60, 65, we've used up 80 to 90% of the ability of our bodies to activate and keep mobilizing at a high level those regenerative cells. And I think this is when we start noticing bigger imbalances in the body. That's what this technology is designed to do, is to help the body bring itself back into balance. You know, our bodies don't know the term diagnosis. Our body doesn't even know what that means. Respectfully, that's a Western medicine word that they use to tell you you've got an imbalance, right? And you heard today from these ladies, as well as themselves and their clients, what they've been able to do when they're able to bring that body back into balance. So you guys just saw how easy it was for me to use this. I slapped it on my chest so you could see it. But we have over 90 clinical studies, and it's through these studies that we tell people, you know what? Use that X39 either on the back of your neck on your C7 vertebrae, okay? You guys, it's just a little bony part at your back of your neck. Don't think too much about it. Or place it below your belly button. But remember, your whole body is light. Your whole body is heat. You can put this anywhere, and it is going to work for you regardless of what you have going on. So I want to touch on, you know, we talked a lot about the heart this evening. It came up for a few of the doctors. You know, through these clinical studies that we have, you will find, if you go to startx39now.com, which I hope Leah can drop that in the chat for you, you will see a clinical study that shows that every 6 weeks that you use the X39, the heart reverses the age functionality by eight, oh my gosh, it just went right out of my head. 8 weeks, no, 6 weeks, 8 weeks. Every 6 weeks, your heart reverses its age by 8 weeks. Who doesn't want that? You even heard tonight that some of the things in our bodies cause issues for our heart, for our cardiovascular system that we might not be aware of. I want to protect my heart because we all have things going on in our bodies sometimes that we don't know, right? And that's what those regenerative cells are there for, is to race in, get to the root of the problems and get in there and repair and restore. Okay. Now, those ladies did share their age. I want to share mine with you because I'm really excited about this. A lot of people get my age and they don't want to tell their age. I'm very excited to tell you that I'm 61 years old and I've been patching for 3 years. And the reason I share that with you is because every 6 months that you use this patch consistently, day after day, week after week, month after month, I hope you go year after year. Every 6 months, the body has the potential to reverse its cellular age by 8 years. Now, I don't know about you. I'm going to test the theory, right? So I had my blood work done. I had my biomarkers run several months ago. And my practitioner shared with me that even though my birth certificate says I'm 61, my body is functioning that of a 27 to 30-year-old. I don't know about y'all, after what everything you heard today, not to be vain, but sign me up, right? That's very, very exciting. Very, very exciting. So what I want to encourage you to do is get back with the person that invited you here tonight. We are all one team. We help each other. They are going to be able to answer all the questions that you have. And if you can't, they are going to make sure that you get your answer. But let them help you. Let them walk you through the support that you need or the things that you want to address first. And I want to remind those that are on here, especially our guest. You've heard some pretty incredible things tonight, but I want you to know that this wearable light technology is also used with those who want preventative measures, who want to be proactive in their health, not reactive. I've always lived a space of being proactive, not reactive. And just like you heard the ladies say tonight, having that ability to put your body in that state like it was younger. I mean, y'all, let's face it. How many 8 to 10-year-olds do you know walking around with gray hair, cardiovascular disease, and using a walker? 0. But how many 60, 70, and 80-year-olds do you see? So I want to leave you with one last thing this evening. Time's going to go by regardless. We can't stop time. The only choice here is, do you want to choose that time to be used up with a body that is degenerating? I kind of like to use the word decrepit. I think it's a little bit more powerful. Or do you want to put your body in that state of regenerating through that time? I personally, to steal, or the phrase was coined by one of our doctors on our team, I would like to see everybody here go out with their boots on and not in a diaper, right? So I encourage you, please get back with the person that invited you. Let them help you. Let them answer your questions and get you started in a way that serves you best, because that's the #1 priority. And then I want to take some time to thank ladies, Dr. MJ, Dr. Debbie, Dr. Holly. Thank you, thank you, thank you for joining us. We cannot tell you how much value you provided tonight. And then always my co-host, Leah Stasny, Senior Presidential Director, who was letting people in all night and trying to fix our little bit of Houston, we have a problem. But I think it was an amazing evening. And I thank you all for sharing it and spending it with us. And we will see you hopefully next Tuesday when we are showcasing the men, the doctors in the different fields. So we will have 3 men doctors on with us. And so I encourage you to come back, invite your family and friends, and we will see you then. Good night, everybody.